for us, Dr. Winder, to speak to people who write for our paper, people who advertise in our paper, and learn more about what they do and how they do it, and kind of go a little more into detail. And it's an opportunity for us, particularly in this era. I mean, the topic that you're managing, basically the topic of mental health, mediation, stress, all these things are topics that are basically at the top of all of our minds right now, as you may imagine. Basically, that's the topic of the day. So I guess could you start by telling us a little bit about your practice area, and how it's been in the last year compared to maybe previous years?
Sure, Elizabeth, and thank you so much for having me on. It's really a pleasure to put some faces to the emails and actually see they're human beings in the paper. My practice has been very focused on certain areas, and one of those is anxiety. And I would say that's the area that's had the most of a impact and has been changed the most over the last couple of months and almost a year now. People always deal with anxiety, but the COVID situation has created a set of circumstances that's very unique and has taken a lot of control away from people in many significant ways. And what that does is makes people feel like they can't manage their lives. And people who have anxiety beforehand has gotten worse. And people who have been fine beforehand suddenly find themselves having difficulty coping. So that's the area I would say has been most changed over the last, since the world has changed since COVID happened.
Okay. And would you say that the kinds of ways that you've dealt with these challenges have also changed? Like, I know in one of your articles for us, you online support groups.
Yeah. The one thing I think has changed the most in terms of the way people cope with anxiety during COVID is it's become much more of a communal experience, where in the past anxiety is very individual and people very often feel isolated. During COVID, it's a worldwide phenomenon and everyone is going through it, and it's something that's affecting everyone in different ways. So I think that anxiety has in a way become more shared, and people feel like it's not something they're going through alone. And that's been helpful because people feel like they're able to reach out for support and participate in groups with other people who are going through similar situations. Mental health is always something that has a certain stigma attached to it traditionally, though that's of course been improving in recent years. But the fact is that people do feel a certain hesitancy to admit that they need help and to reach out for help and to actually implement the help that's being given. And I think the ability to just acknowledge that it's something that we're all going through is something that is helpful to people and makes it easier to deal with the anxiety that it brings.
Mm-hmm. Okay. And I guess going back to what you said as part of the first answer, you said that anyone who had anxiety issues before the pandemic began, it would be more intense now. Does that follow into your other practice areas of sort of family mediation, perhaps a family who might be in the midst of a separation or a divorce? How does that interplay?
Yeah, family dynamics, whether it's in a intact and traditional family that's doing well, or a family that's going through some sort of trauma or separation, the whole isolation and quarantine and being able to be places or not being allowed to leave, and people's schedule changing and being at home or not at home has been devastating to a lot of people. And in certain circumstances where there was stress beforehand, whether it's a family situation or other, even just an individual anxiety, like you mentioned, it has gotten worse very often for people, especially someone who was kind of sort of coping or almost not coping to begin with. And all of a sudden, they lose their job or they're forced to stay home or there's a change in income or education or it's just a huge and sudden change. And I don't think anyone is really prepared for it.
So the aspect of mediation, is that a strong part of your business? The sort of dealing with issues, attempting to perhaps work it through before any kind of lawyer would get involved, or is that also happening at the same time concurrently?
Well, when you talk about mediation, it's a very broad topic, and that's a separate area of my practice. Not to kind of jump into too many things, but
Okay.
the anxiety and support and working with people individually, that's kind of traditional psychotherapy that I do, which is one part of what I do. The mediation part of my practice is separate. I'm not acting as a psychologist in that capacity. I am a certified divorce and family mediator. Um, and in that capacity, like you said, my role is to help people navigate situations that have conflict. And when there's conflict, there needs to be some sort of resolution, whether it's a resolution that people choose or work towards, or one that ends up being forced upon them, or even one that just kind of ends up happening organically. Conflicts are resolved one way or another. And my job as a mediator is to help people resolve conflict in a way that is most advantageous to everyone. So overall, to find the solution that works best, where not necessarily is everyone happy, but everyone is the happiest that they can be under the circumstances. And yeah, COVID has certainly created a lot of conflict and situations that require mediation. And it's definitely been a expansion of my focus because of that.
Okay. And I also noticed that your psychotherapy practice encompasses helping people with addiction issues. So could you talk a little bit about that?
Yeah, so it's not one of my kind of main specialties. Like I don't work a lot with people who addiction is their primary issue. But the fact is that addiction in some form is so prevalent today. Even people who aren't traditional, addicts, have some sort of addiction, and it's something that affects people in a lot of different ways. Um, and yeah, of course, COVID and the whole world situation has caused an increase in addiction. That's well documented. And of course, in the concurrent negative effects of addiction, it's also made it more difficult for people to receive help in a lot of ways, which is why the virtual type of support and video therapy has been a huge part of the way people get help, and it's great that that's expanding. But yeah, addiction in some form has been definitely increased recently, and its effects are very much a ripple effect, where it obviously affects the addict functioning, and it affects their job, their family, their social network, and their ability to get support in any way.
How would you characterize, I don't know what we're calling it, teletherapy, telemedicine? How would you characterize that as in terms of effectiveness toward traditional therapy? Like, do you feel that, I mean, obviously it's likely to be better than nothing. If someone has a choice between nothing and digital therapy, I guess they would choose the digital therapy. But do you feel that there is parity in other ways? Is there anything that's really better?
So it's a great question, and it's something that there is a tremendous amount of discussion and literature developing in terms of formal psychological research right now. And we're not going to know for sure for years of what the
Mhm.
actual cumulative effects are of these things. So I can only speak anecdotally and about my personal practice and what I hear from colleagues. What I find is that there's a kind of demarcation between people who hate it and people who are okay with it or actually like it. And I think to a large degree that depends on the type of therapy being practiced. Um, my type of therapy, what I do is very solution focused, practical, kind of solving problems, helping people identify the skills that they need to fix whatever is causing them issues, and learn those skills and put them into practice. And in that regard, my type of therapy is more along the lines of coaching. And I like to see it that way because it really is a very kind of step by step and goal oriented method. So for people who do my type of therapy, video therapy has not necessarily been a bad thing, because all those things, kind of talking through things and being pragmatic and having a step-by-step method to getting towards a goal, are just as achievable through video therapy as in person. And if anything, video therapy has increased the availability of therapy and people's ability to get more therapy when they might not have otherwise been able to. Um, whether it's just someone who wouldn't get therapy otherwise, or someone who can see me now, who lives 500 miles away, who just wouldn't be able to get to me otherwise. So I like it. I think it's great. Yeah, obviously, given a choice, I would rather have someone in my office. But the fact is, I don't feel it's been a decrease in effectiveness for people who do video therapy.
Are you seeing patients in person as well?
So I am. I went back about a month and a half ago, and I am offering both in person and video, just based on people's comfort level and interest.
Okay. So people are perhaps choosing to stay online, even though there is now this in-person option again. So that's
Sure.
interesting.
Yeah, listen, it's very convenient. There's no way around that. If someone can avoid, driving 45 minutes, to therapy after a long day of work, it's easier to stay home in your pajamas, and I think it's great.
Right. Okay. That's great. I mean, it's good that it works for the people that it works for, I guess. That sort of dances around the topic that some people might not be able to uh, get the same level of care from a digital experience. Would you say, I mean, your focus is not children, is that correct?
Right. I don't see children. I see kind of older adolescents and up.
Ah, okay. So, because I feel like the younger a person is, it's potentially like the less effective um, teletherapy might be. Would you agree with that? Agree, disagree?
Yeah, absolutely. Especially when it comes to visceral kind of hands-on therapies, play therapy or something like that. Yeah, I mean, obviously, that something like that would be more effective in person. And I think you're right. I'm speaking from my perspective as a therapist and what I can do and what is effective for me. But from a client standpoint, if there's someone who's more comfortable, or just doesn't feel that they can benefit from digital therapy, then that's something that's definitely an issue.
Mhm, mhm. And did you, during the pandemic, did you see sort of any, I don't know, changes in your clients that you feel like you would or wouldn't have noticed if they were in person? Like, do you still get the kind of level of ability to assess the I don't know, the intimacy of seeing whether people are, I don't know, whether their eyes are darting elsewhere if they don't want to talk about something? Are there sort of intricacies that you're able to pick up on in this digital experience? And then I'll move on. I promise that's my last question about the digital.
No, you know what? I could talk about this, extensively. It's a really important topic. And again, all things being equal, in person is certainly better. I don't think there's any
Okay,
question about that.
right.
But as a counterpoint to what you just said, in person, gotta wear a mask. So
Ah,
now,
oh, good
there's a
point.
level of detachment there. And, even though you can see a person's eyes, not seeing their mouth is a huge, it's a huge impediment. Um, yeah, everything has a trade-off. And if we can have the best case scenario, we'll be back to normal. But until then, we're doing what we can.
That's a really good segue into my next question, which is the is back to normal ever a goal that we're gonna have at this point? Do you feel like we're gonna at some point see a world that we remember? Uh, Mentally, ideologically, will there be kind of a post-traumatic stress experience following the COVID era? How are our kids gonna do as they move into adolescence? Um, how do you think people are going to feel when they get the sniffles in a year? Will the same thought process go through their heads?
Yeah,
Uh,
and yeah, it's a very big question. Obviously, I don't think there's an easy or quick answer to that. But I do feel, from a mental health point of view, that things are never going to be as they were. um, things move forward and things change, and the world is certainly a different place today than it was a year ago. Not just because of COVID, obviously, like you said, ideologically, the world has shifted tremendously, and that's been a huge factor in people's emotional and mental health as well. Um, I don't think it's possible to really know, what the world's going to be like. If we'll be paranoid if we have sniffles or other effects. But I definitely don't. I think anyone who's looking to get back to the way things were and feel exactly as they used to feel, from a mental health perspective, I don't think that's it's a reasonable or achievable goal. And I feel like if anyone is hoping for that or trying to get that, it's just going to cause a feeling of helplessness because it's not really going to happen.
Mhm. So one of the things that we get the opportunity to do at our paper is actually discuss quite often, perhaps ad nauseum, the interplay between what's happening in the world, inside our world, and our faith. So can you maybe address a little bit about, I mean, the fact that obviously I don't know too much about you past your bio, but obviously you're advertising in a Jewish newspaper. You've been a longtime advertiser in other Jewish newspapers. Perhaps you can address how faith plays into your work and maybe how your potential clients might come to you and might have a different experience with you than they might have with a secular therapist.
So I feel like my answer might disappoint you a bit because
Okay.
I really don't mix my personal beliefs into what I do at all, to whatever degree it's possible for me to do so. Um, Obviously, I'm Jewish. I'm from a firm background and part of the Orthodox community in the town where I live. Um, but my focus when I work with anyone is working with them where they are, whether that's Jewish or any other religion or any part of Judaism. Um, so in a broader perspective, I think that people's faith is obviously huge in terms of how they deal with anything. If someone has a sense of that there's some larger power at work and things aren't just random, then things like this pandemic and things like the world changing as it is today become more kind of acceptable, and things that cause anxiety for other people are okay because it's okay that we don't understand them. And to that degree, and research has borne this out consistently, people with a strong religious belief set have less anxiety from the perspective of things that are out of our control. It can cause anxiety in other ways, but not that one. And in terms of people's increased difficulty in dealing with stressors today, I think that religion and a strong belief system and a comfort with a belief that things happen for a reason is something that can be tremendously helpful in dealing with anything that's going on today. Um, in my practice, I see a wide variety of people. I generally have around 50%, Orthodox Jews, just because people tend to feel comfortable with someone from their own background. And that's a reality in psychotherapy. Um, but I have a very varied practice, and I see people from all backgrounds and religions. So yeah, like I
Okay.
said, I hope that wasn't a disappointing answer.
No, not a disappointing answer at all. Would you say so? It seemed like initially when we started the conversation that your focus really is like CBT style classical coaching, cognitive behavior. Are there any other sort of focuses other than the mediation piece? Are there any sort of other focuses in your practice or styles of therapy that you are called upon to use?
Yeah, so and you mentioned CBT, and CBT is one tool, and that's kind of the most well-known tool when you think of the concrete type of therapy. But the types of therapy I practice is not just CBT. It's like I said, the main focus of what I do is goal-focused work, meaning that everyone has goals, whether we know them or not. And when someone presents with a stressor or a problem or something that's holding them back, that's just another way of saying that they have a goal. And my job as a therapist is to translate that and say, okay, here's what you're feeling. Now let's figure out how you can get to a place where you're feeling something you want to feel. And once we identify that, then the question becomes, well, what skills do you need to get there? And then we develop a plan to develop those skills and actually put them into play. Most of my work is actually, like I said, it's kind of a coaching focus. One analogy that I give to my patients constantly is, if let's say you want to, lift weights and you want to, pick up 500 pounds. So if you go into a gym and you have a session with the trainer and you sit and talk once a week and you do that for, 5 years. So how much pounds are you going to be able to pick up? And the answer is, well, the same amount that you started with, because you can learn a lot and you can know a lot and you can, explore your feelings a lot, but until you actually put in the work and do that in a very organized and step-by-step way, you can't meet your goals. So most of my work is helping people to go through those steps and actually achieve the goals that we need to get to the place that makes the anxiety or whatever the negative emotion go away.
Okay. Okay. That's useful. That sounds really, really a useful goal-oriented approach. So I guess maybe one last question, if that's okay with you, since I know we're at our 20-minute mark. If I had one last question with a therapist, it would always be, so can you tell me in like 2 minutes something that I can do right now to maybe make stress a little lower in my life, to remove a stressor that is present for everyone, that might be, and do you have an idea, a nugget, a concept that we could think about that you could leave us with that would be of use during this highly stressful, highly charged time?
Well, my first answer to that question would be to get a dog,
Oh,
because
really?
I'm a huge fan of dogs, and I think they can lower stress tremendously. But as a more serious answer, I think the most important concept in terms of lowering stress is being able to draw an effective line between things that we can control and things we can't. And the problem very often is that when we feel we should be controlling something and we're trying to, but we really can't, that's what causes anxiety. That's what causes a feeling of helplessness. And a lot of my work is helping people draw that line more effectively, because we all think we're drawing it effectively. We all think that we're not trying to control things that we shouldn't be, but very often we are. And just knowing the difference between things that you should be letting go of and things that you should be working on is, I think, the most important step towards reducing stress.
Okay, very good. Very useful answer. Thank you so much. And my family did get a fish also, by the way. So pretty good for on that.
Whatever, whatever works for you.
We had a pandemic fish as opposed to a pandemic puppy, but okay.
Okay.
Anyway,
I'm-
my kids really like it, and it's fun, and it's someone for us to care about other than ourselves, and it's all positive. So thank you
that's
so
a great thing.
much for your time. Should we end here with the last question, or do you have anything else maybe you'd like to say to the group?
I have nothing specific to add. I want to thank you again for having me. Like I think you mentioned, my office is in Highland Park, and I'm available in person or by video. And my website is drwinder.com. That's drwinder.com. And feel free to reach out with any questions.
Okay. Thank you so much for your time.
Thank you so much. Take care.